guys, if I had a nickel for every postmenopausal woman who comes into my practice with an A1C just in that prediabetes range, who is tearing her hair out, trying to get her A1C down and can't, and is convinced that she has metabolic syndrome and insulin resistance, and it's the tip of the iceberg, which we always tell people with prediabetes, because we tell everybody that it's not pre anything, that it's metabolic syndrome, hyperinsulinemia, because that's the case for so many people, but it's not everybody. And I think we're doing people, especially women over 50, a disservice, because there are different categories of prediabetes, and they are one of them. And we're going to talk about that on Friday at the November CGM interpretation webinar. So this Friday at noon Pacific time. We're going to slice it a few different ways, whether it's lower insulin production or increased hepatic uptake of insulin versus insulin sensitivity, insulin resistance, but also what to look for when you're doing a patient history, getting a full history, evaluating the medications they're on because they could be contributing to their high blood sugar, evaluating their labs or what labs to suggest so that you can make an assessment, a nutrition assessment for the root causes of their elevated blood sugar. These are all really important, and I want to discuss them at a pretty high level on Friday. For those of you who are working with patients in hormone health, especially women in peri- and postmenopause, anybody in prediabetes, and you're really wanting to be very sophisticated about how you stratify your assessment of prediabetes, which I think you should. Let's talk about it. Glucotypes on Friday. Be there.